Exostosis. So exostosis is when you have a new bone growing on the surface of an existing bone. They are seen in various places throughout the body, like in the ear, but I'll be more specific on the shoulder. The anatomy involved are the bones that make up the shoulder, like the clavicle, acromion, scapula, coracoid, and the humerus. Because exostosis is an accumulation of abnormal cells, it is considered a tumor and can become malignant. With that being said, it is only a small 5% chance. Now for some MOIs. One could be a direct blow to a bony landmark of the shoulder, also known as a shoulder pointer, similar to the hip pointer that we learned about in lower. Another could just be chronic bone irritation. A way to get exostosis without a physical MOI is having a family history of it. When exostosis is obtained inherently, it is called hereditary multiple exostosis. Some signs and symptoms to be aware of is pain anywhere from a 1 to 10 rating, a sense of pressure on tendons, nerves, or muscles, angular deformities due to the growths, limb length differences, and obvious hard bumps. There are no special tests for exostosis other than palpation of a new bump or growth that the athlete points out to you. There are a couple of predisposing factors such as having exostosis in your family history or having a shoulder pointer injury in the same or general area as the growth. The bone that was impacted in the shoulder pointer injury could have had a bad reaction to the irritation. Most of the time, treatment is depending on the severity. If it is extremely painful or blocks range of motion, then management is skipped and a referral would be the next step. A referral needs to be made to a team physician or an orthopedic specialist for imaging. No immobilization is necessary unless surgery is involved. There is no prevention for family history conditions such as hereditary multiple exostosis, but padding could maybe reduce the chances of a direct blow reaching the bone and causing irritation. There are no Mulligan techniques for exostosis. The patient is a 36-year-old male who had exostosis just distal to his humeral head. It affected the patient's range of motion with painful restriction, and strength was not affected. It was surgically removed. There was no comparison. The outcome was that they removed the exostosis after having it for 6 months. The doctors monitored the patient's affected shoulder up to a year after surgery and saw no complications. The time overall was 1 year and 6 months.